Dr. Shabana. I'm consultant nephrologist and transplant physician. So presently today I'm going to talk about the edema. So what is edema? Commonly does the all the people common people knows what is edema. So edema is a word which means swelling. It comes from the Greek word which is edion, that means to swell. So edema is nothing but swelling of the body. So it can be does edema present only in the face or it present only in the legs? So edema can present in all over the body also. So mostly the patients, the normal people who are obese, so they will face that their legs are getting swelled up. That means they feel that the legs are getting swelled up. So that is also called as an pedal edema. So when the swelling is present in the legs, it is called as an pedal edema. And when the swelling is present in the face, usually we see the puffiness of the face. Then when the swelling is present in the whole body, then it is called as an anasarca. So does edema is an pathological or is an physiological? So usually that means whether we should worry when we get swelling of the feet. Definitely if you are diabetic and if you are hypertensive, then you should get check your kidney functioning, then you should get check your cardiac functioning. And if you are hypothyroidism, then you should check your thyroid levels also. So and edema is also depends upon the timing of the day. Suppose a patient is normal throughout the whole day, but when he is getting up in the early morning, he is noticing that there is a puffiness of the face. So that is puffiness of the face is abnormal when you are getting the swelling of the face in the morning hours, because usually the kidney patients gets the swelling of the face, swelling around their eyes. That is called as an puffiness of the eyelids. So that is an abnormal thing. So if you are diabetic and if you are hypertensive patient, then it's better to check your kidney functioning, heart functioning, and also liver functioning. So I will come to the causes of the edema. What leads to the edema? Edema means swelling of the body. So what condition leads to the swelling of our body naturally? So the different causes, like first common cause, it can be in most of the females, it can be because of the chronic anemia. Anemia also leads to the pedal edema, puffiness of the face. Then second cause, it can be hypothyroidism. And most common cause now in the diabetic and hypertensive patients is uncontrolled BP. Uncontrolled BP also leads to the edema. And then if the patient is already diabetic and hypertensive, or this patient is in chronic kidney disease, that means patient has kidney diseases since years or since more than 3 months. They also present with the pedal edema. That means they present with the swelling of the feet. So the causes like heart diseases, like heart failure, because heart has to pump the blood into all over our body. So if heart functioning is decreased, that also leads to the pedal edema. So heart functioning, if there is an abnormality in the heart functioning, or if there is an abnormality in the kidney functioning, because kidney, what does kidney do with our body? Actually, kidney removes all the waste and it removes all the excess water and it removes excess salt from our body. If kidneys are not functioning, that means salt and water is retained in our body. So that also leads to the pedal edema or swelling of the whole body. So one is cardiac, then second is the kidney diseases, then third is the liver diseases. If the patient has a cirrhosis, that means a chronic liver disease is there. Suppose patient is an alcoholic, or patient is diabetic where their liver has been damaged, or patient has some infection which has damaged the liver, that will lead to the cirrhosis. Cirrhosis means strengthening of the liver. So that leads to the, again, because of the deficiency of the albumin, again because of the deficiency of the protein deficiency, all these things leads to the edema. So common causes is like heart diseases, or it can be because of the kidney diseases, or it can be because of the liver diseases, or it can be because of anemia, that means low hemoglobin, or it can be because of hypothyroidism also. And suppose physiological means without any cause, patient is still getting the edema, then that means that it might be because of physiological. If suppose patient is obese, that means more than the estimated or required weight, patient has the excess weight, then that time also it leads to the edema. And even the long standing, on long standing also we'll notice the swelling of the feet. So if you are noticing the swelling of the feet on the long standing, you need not worry. But you are diabetic and you are hypertensive or you are hypothyroidism, then you have any family history of the kidney disease, it's better you get checked with your all the organs functioning once in a year, and so that you can come to know what is leading cause of your edema. Then coming to the treatment. So the treatment is like, first, if it is because of the kidney dysfunction, then what we have to do? Kidney dysfunction, basic investigations we have to do, like creatinine, and then whether you are losing proteins in your urine. That can be confirmed by the urine examination. So with that help, and whoever the doctor you are visiting, whether it might be physician or whether nephrologist or cardiologist, they will tell you what is the cause of your edema, and then they will diagnose the cause of your edema. Then by at that time they will tell you, suppose if it's because of any kidney dysfunction, then they will prescribe you diuretics, and they will advise you to decrease your salt intake, and they will ask you to control your blood pressure levels, so that edema will be decreased. Then coming to the cardiac, same way, cardiologist will advise you, or your general practitioner or physician will advise you that you should reduce your salt intake should be reduced, and they will advise you the some diuretics. That means diuretics means the drugs which will remove the excess fluid from your body. That will help you in the diuresis, so that extra water will be removed through urine. So cardiologist will see what is the percentage of your heart functioning, and they will tell you, and they will prescribe the required medications. Then suppose, then coming to the other causes of the edema, as I told you, the most common causes are heart diseases, kidney diseases, thyroid, and anemia. Then other liver diseases. Then what are the other causes? Suppose if you are getting swelling only in the one feet, usually what we see, what we doctors see, if suppose patient is complaining, okay, I am getting swelling of the feet, then we'll see whether the swelling is there only in the one feet or it's present in both the feet. Suppose if swelling is present in both the feet, then we'll check whether it is pitting edema or non-pitting edema. Pitting means what? Whether whenever we apply the pressure for suppose 2 seconds or 20 seconds, then we'll see with after applying the pressure, there should be a dimple, there should be a pit. If there is a pit in the leg or in the body, then that is pitting edema. So pitting edema has different causes. As I said, it is the other causes like renal, kidney diseases, or heart diseases, or hypothyroidism, and anemia. So this leads to the pitting edema. Then non-pitting edema. Non-pitting edema usually you get in the hypothyroidism. And then you will observe the legs, whether these legs are shiny or non-shiny, then whether it's present only in the one leg. If it is present only in the one leg, then we will see the temperature, the color of the skin, then shininess of the skin. Because if the swelling is present in, suppose if it is present only in the one leg, that means it may be because of the some blood flow issues in that constrained leg. Suppose it may be because of the venous insufficiency. Venous insufficiency means there may be the deficiency in the flow of the vein, blood flow in the veins. So it may be because of the varicose veins, or it may be because of the some clot present in that vein. That will also lead to the swelling in that single limb, or it may be because of the infection. Suppose like elephantiasis, Wuchereria. In elephantiasis also there will be unilateral pain, unilateral swelling will be there. Then again, swelling, whether it is edema is painful or non-pain, and it's not painful. If it is painful, then again it is infection, or it is clot in the veins, or it may be because of the any infection in the leg. So that we usually whenever the patient comes with the swelling, this general observation and general examination we do. By that general examination and by help of the other supporting investigations, we'll come to know what is the cause of the edema and what is the and how to treat it. Then general precautions. The precautions what we advise is diabetic patients, hypertensive patients, and patients who have the chronic liver diseases. So are a patient who are obese, it's better to avoid high salt intake. It's better you take the low salt. It should be less than 3 grams per day. And you avoid, if suppose a cardiac patient is there, or a kidney failure patient is there, already chronic kidney disease stage 5 or stage 4, presenting with the huge, that is like severe pedal edema, and that edema is increasing to the whole body. That we call as an anasarca. So then we will advise such patients to reduce even the fluid intake also. We'll restrict the fluid intake. So depending upon the cause of the edema, the treatment will also differ, and mostly the salt intake has to be decreased. And the advice what we can say is that it's better you ask the what is the cause of your edema to your general practitioner or to your treating doctor, because as I mentioned, the common causes like kidney diseases, heart diseases, liver diseases, are chronic malnutrition and anemia and hypothyroidism. All these things leads to the edema. So just screen out what is leading to your edema. And as prevention is better than the cure, it's better you check the cause of your edema. Thank you.